Does Medicare insurance cover palliative care?
Sure, palliative care is a specialty, so consultants, doctors and advanced nurses who do the consultations in palliative care are paid like any other physician. Now, palliative care in some communities is a service beyond a consultation. In some communities, there is not that service out in the community. But private insurance, Medicare and Medicaid, will pay for palliative care if it's available in your community.
Is palliative care different from place to place?
Palliative care is totally different from place to place. Location matters. In university medical centers, palliative care is often a very big part of the care delivered. But in community hospitals in rural areas, palliative care may not exist at all. Some places it may be a palliative physician like myself or the wonderful palliative nurses that work with me as a consultation service. In other places, palliative care just doesn't happen at all. So location matters when it comes to palliative care. You need to check in your community and region to see if palliative care is available and what kind of palliative care it is.
Will I be able to stay at home if I'm receiving palliative care?
That's an interesting question. The question, can you stay at home if you're receiving palliative care, suggests the confusion about palliative care. It suggests that palliative care is only hospice care. Hospice care absolutely provides palliative care. Symptom management and your choices become their instructions. But palliative care is more than hospice care. It can be delivered, if the community supports palliative care, for those people seeking interventions to get better, if it's possible to get better. So in your community, in your doctor's office, in your hospital, ask what hospice care means and ask what palliative care means.
Is it possible for me to be admitted to the hospital to get my symptoms under control and then go home again and receive palliative care services?
During any hospital stay, the first concern of your primary doctor and the specialist who attend you is understanding your clinical situation. Clinical, that's your medical situation. They're not likely to look as a priority at your symptoms: pain, breathlessness, nausea, constipation. So you need to continue to reinforce for yourself and people you care about in the hospital that symptom management is palliation and it's important to you. Once your symptoms are addressed and managed in the hospital, you need to know if a palliative service is available outpatient, or if the comforting services you had in the hospital can be continued by your primary care physician in the community when you go home.